Depression is a common mental disorder. It is estimated that 5% of adults and many people suffer from it. It is considered by having persistent sadness, lack of interest or pleasure, and it can also disturb sleep and appetite. There are different types of depression, like major depression, persistent depressive disorder, bipolar disorder, seasonal affective disorder, psychotic depression, postpartum depression, situational depression. In this video, we will talk about many types of depression, but mostly about these ones that are the most common ones. We'll talk about how does this mean and how does it affect people. Major depression. Major depressive disorder isn't something that eventually passes. While most people feel sad at times and in their lives, major depression is when people is in a depressed mood most of the day, nearly every day for at least 2 weeks. Some people feel depressed without knowing why. This is said by the University of Oxford. Persistent depressive disorder. Persistent depressive disorder is a continuous long-term form of depression. You may feel sad and empty, loss of interest in daily activities, and have trouble getting things done. You may also have low esteem and feel like a failure and feel of hopelessness. This is said by the University of Oxford. Bipolar disorder is a mental illness that causes initial shifts in a person's mood, energy, activity, feels of disconcentration. This is said by healthline.com. Seasonal affective disorder or SAD. Seasonal affective disorder or SAD is a type of depression that comes and goes in a seasonal pattern. SAD is something known as winter depression because the symptoms are usually more apparent and more severe during the winter. This is said by healthline.com. Psychotic depression affects gender, cisgender women, and transgender people of any gender have a higher risk of depression. Older adults have a higher risk of MDD with psychosis, a family history of bipolar disorder with psychosis, schizophrenia, of MDD with psychosis. Postpartum depression. Most commonly, postpartum depression is caused by after you give birth. It is a type of depression that comes and goes in a seasonal pattern. But genetics, physical changes, and emotional issues may play a role. Genetic studies show that having a family history of postpartum depression, especially if it was a major increase of the risk of experiencing postpartum depression or physical changes. This is said by Medical News Today and WebMD, the one before. Situational depression. Situational depression is a type of adjustment disorder. It can make it hard for you to adjust to everyday life following a traumatic event. It is known as a reactive depression.